Hello, my name's Dom Conroy, and I'm the course leader of the MSc in Addiction and Mental Health at London Metropolitan University. What I'd like to do here is just to take you on a short tour in the next few minutes of one of the key debates in addiction psychology that you would come across if you were studying addiction psychology at university in a higher education setting. So we can think about addiction as a starting point, thinking about the disease model for understanding addiction. What does this mean, the disease model? Well, it's really what we're talking about here is the dominant theoretical framework for understanding, any kind of addictive behavior. And this traces back to the 18th century onwards, where we're replacing thinking of addiction as some sort of moral failing, some sort of moral lapse of judgment, and starting to think about addiction within the medical disease model framework. So it's something that's gone wrong physiologically with a person to have caused them to become addicted to something. This is a common pathological pathway across all sorts of addictive behaviors, alcohol and tobacco, smoking, the obvious examples. Clearly, there are other drug addictions we can think about as well, as non-substance based addictions. And there's a huge volume of evidence from multiple fields, from behavioral neuroscience, genetics, neuroimaging, psychopharmacology, that really kind of feeds in and substantiates the disease model thinking about addiction. There are all sorts of illustrations of theories that are following in this tradition of the disease medical model of addiction. So we can think about theories reflecting a behaviorist approach. So Berridge et al.'s incentive sensitization theory, the classical conditioning, Pavlovian work of the behaviorists at the start of the 20th century is apparent in some behaviorist theories of addiction as well. There are theories also that reflect a biased cognition sort of approach, and these also reflect kind of the underpinnings of a disease medical model of addiction. So we're thinking here about things like the attentional bias hypothesis theory, gateway theory, and the unstable preference theory. All of these theories differ in terms of how they kind of frame specific measures that we should be thinking about, specific concepts, the relationships between theories and constructs in these models, but all of them have this thing in common where they're following in this idea that something's gone wrong organically, something's gone wrong sort of biologically with an individual to give them this issue around addictive behavior. There's quite a contrast here from John Booth Davies, who in the early 90s, building on work he'd done in the 1980s, came up with this idea of the myth of addiction. This was the title of his book, first published in 1992. So he was writing about addiction, talking about, getting this idea of thinking about individual sort of responsibility and personal power and choice around becoming addicted to particular substances, to drug use. He's interested in this idea of the adaptive sort of functions that these, titles around addiction serve someone who's going through particular addictive problems. So we can think about this idea as sort of quite useful in terms of challenging the disease model and pushing forward this idea of the role of personal choice, acknowledging that it's been neglected in the disease model account of addictive behavior that's so dominant in the field of addiction to this day. Thinking instead about the possible sort of practical implications for thinking about the patient's choice involved in addiction. This might, for example, steer patients away from being understood as helpless addicts, instead kind of reframing an understanding of patients that they can actually be understood to be making particular choices. They might not be exactly the right choices. These might be choices that create all sorts of problems, in fact, but they are nevertheless sort of choices that are being made on a particular basis, on a particular rationale. So let's evaluate this idea of the myth of addiction and sort of similar approaches. I mean, John Booth Davies is the most famous one, this idea of the myth of addiction. There are lots of other sort of different theories that follow on a very similar line of argument, thinking about this idea of choice. So what are the pros here? Well, we've got a spotlight on difficulties with addiction, looking at the language involved with addiction, burrowing down into that further and looking at possible adaptive and even maladaptive functions that language around addiction may serve. It might also explain why some individuals spontaneously recover from addiction. It's a phenomenon that we can't explain with a disease model account of addiction alone. We could say, on the downside of things, that it's denying addiction's reality. It's contradicted by this huge body of evidence, for example, severity of urges to smoke. It's also arguably, a really not very helpful to sufferers and their families facing these daily miseries of addictive behaviours to those suffering and those around them by referring to addiction as a myth. Where do we go with this idea of choice and addiction in the 21st century and beyond? Well, it's pretty sort of important stuff to be thinking about, especially as we start broadening our definitions around addiction. We're starting to think about things like gaming, smartphone use levels, social media engagement. These addictive behaviors, and this issue of choice cuts into our sort of understanding of how we're going to draw in these behaviors into particular diagnostic sort of understandings of addictive behavior. And there's a lot of disagreement around this. This idea of internet addiction wasn't in the Diagnostic and Statistical Manual of Mental Disorders, but it was recognized as a disorder by the American Psychological Association. There's growing evidence of links between addiction to digital devices and mental health, but it's difficult to untangle, and this role of choice really does cut into all of that. Thanks very much for watching this taster clip. You'll find out about this issue and topic area, amongst many others, if you study on the Addiction and Mental Health MSc programme at London Metropolitan University. You can find out much more about the course programme on the course website. Thanks very much for watching again, and we hope to see you soon.